professional and researcher in the management of a disease that is considered to be one of the world's most common diseases, affecting more than half the world's population, which is periodontitis or advanced stages of the disease of gums. Unlike the big four NCDs, unfortunately, periodontal disease has not received enough attention despite being closely linked to several systemic diseases in the body. As a practitioner and also as a person who has been a part of several community outreach programs for the past 10 years, I can state with fair confidence that periodontal disease affects a large number of people, and most of them are usually unaware of the consequences until the disease reaches a stage where it cannot be managed by simple preventive procedures. Untreated periodontal disease leads to tooth mortality, which ultimately leads to poor nutrition, especially among the elderly. While some amount of gum diseases is expected among the elderly as age progresses, it is worth noting that it can be controlled to a large extent by following simple oral hygiene practices all throughout your life. In my limited experience, I have found that people do not prioritize oral health as much as that for other chronic diseases. Generally, the oral health-seeking behavior is poor and restricted to times when one is affected by pain only, and by this time the damage is generally done. While there are several treatment options available for advanced stages of these diseases, I would like to say that from a public health point of view, it seems too little and far-fetched in terms of availability and affordability. So at this juncture, I would like to inform the public who are listening to this to understand that oral diseases to a large extent is preventable by good oral hygiene practices like proper brushing and flossing, and even if it has progressed to a mild stage, it can be controlled to a large extent by seeking timely professional help. So please make dental checkup a routine once or twice a year, for it can go a long way in having a good quality of life. Having said that, from a public health system or policy point of view, we need to have a different approach, because the utilization of services by the public depends upon the provision of services by the health system in place. The global burden of diseases 2019 estimates that there are about 1,090 million cases of severe periodontal disease globally, compared to about 500 million odd cases of diabetes globally. That is almost double. What is interesting here is to note that research has been showing that periodontal disease shares similar risk factors, namely diet, hygiene, smoking, stress, etc., with other non-communicable diseases like diabetes, hypertension, and cardiac diseases, thereby opening doors for integration of oral health with already running programs for the control of non-communicable diseases, which is something that we call as a common risk factor approach. So I feel, as a community of oral health professionals, we need to advocate for this integrated or collaborative approach as a practical and sustainable solution to address the increasing burden of oral disease.